Welcome back into Wave 3 Listens Live. I'm Michael Vanover, joined by a very special guest today. It's Dr. Woo from the Dr. James Brown Cancer Center. Dr. Woo, how are you?
Very well, thank you.
Good, thanks for being here. Now, you're here today to talk about something kind of new and exciting. It's the CyberKnife. Tell me a little bit more about that.
CyberKnife is not really a knife. It's a virtual knife. The reason is, it's actually a radiation treatment machine. But the unique features are that it has a robot, and it's a very versatile robot. At the head of the robot is a radiation treatment machine. It gives out very precise beams of radiation to treat tumors. It's so precise, so it resembles that of a knife.
Right.
That's why it's called a CyberKnife, yes.
But a lot of times people associate a knife with pain, and there's no pain here.
There
right?
is no pain. There's no sensation in this. There's no pain. You don't see this beam. You don't feel it. For the patient's point of view, you just lay there, and the machine does its work.
Now, what types of tumors is this best suited for, and maybe other medical conditions?
It's best used for certain brain tumors and certain vascular malformation in the brain. Spine tumors, lung cancer, especially early stage lung cancer, liver tumors, pancreas, prostate.
Wow, you got the list there. So it can do a lot of good. Speaking of that, tell me about some of the positive results and some things that the CyberKnife has been able to do.
One of there are a couple of areas that have quite a bit of known results already. For example, for early stage lung cancer, today, using a technology such as CyberKnife to give 3 to 5 intense radiation treatment to the tumor as an outpatient,
wow,
the result is equivalent to that of surgery.
And it's outpatient? It's
outpatient.
Well, you can't beat outpatient for
you
something
just come
like that.
in, you just go home after that, right?
Well, a lot of people, you know, anytime there's new technology or even developed technology, people are hesitant. You know, they're a little scared, they're a little worried. Talk about some of the pushbacks out there, maybe some of the negative side effects, just to put our viewers at ease.
Now, one of the things is that it is an expensive technology, so it's not always available, accessible in everywhere. We only have one in Louisville, but we can overcome that by accommodating as many people as appropriate. The treatment is totally painless. It does require some time, people laying on the table, sometimes up to an hour or so. The side effects wise, so far there have not been any excessive side effects. Now, the one area that there have been quite a lot of experience is prostate cancer. The standard way of treating, or traditional way of treating prostate cancer is have someone coming for treatment for about 40 times, which means to say it lasts 8 weeks on a Monday through Friday basis. CyberKnife is able to do that in 5 treatments over maybe a 2-week period. And the result of that appears to be every bit equivalent to the long-lasting 8-week treatment. It's certainly more convenient.
Sure.
The patient has a lot less out-of-pocket expenses. And interesting, looking at the Medicare costs, it is about a third less.
Well, and I think a lot of times people in the Kentuckiana area, they may not know how rare this thing is. So tell me, you know, how many CyberKnives are there out there, and how lucky are we to have one here in town?
There are, I think, in the world about 200, maybe.
In the whole world?
Yes.
And we have one here in
We have one here in Louisville. It took us a long time to get it.
and they can find it at the Dr. James Brown Cancer Center, correct?
There is a phone number that people can call for inquiries, and there's a website.
Yeah, and that phone number is 502-217-8200. You can see it on the screen, or you can go to LouisvilleCK.com to find out more information. Dr. Woo, it sounds really like an exciting technology that's been developed over the years, and we're really lucky to have it here in Louisville. So again, people can find out more information. I really appreciate you being here with me.
Thank you very much.
Thanks a lot.
Thanks.
All right. Well, we'll be back on Wave 3 Listens Live in just a moment. We'll send it back out to John Ramsey. Stay with us.